Hello everyone. Today I'm going to show you the correct use of butterfly needle when you're taking a blood sample from a patient. There are certain patients that require you to use a butterfly needle, which is patients that are having cancer treatments as their veins are quite fragile and thin, patients with tremors, also children, and for the back of the hand collection. Now with my display here, I've got the 21 gauge needle and the 23 gauge needle. They both are 3/4 of an inch long, which is the needle is there. There's also a needle inside this black rubber tubing, which when placed onto the barrel, then the tube goes into that needle, and that's how the blood is transferred into the tube. The length of the tubing on the butterfly needles is the same, but the most important thing I want to pass on to you today is how to use them, not to be frightened to use them, and make sure you use them in the correct space. Okay, so I've washed my hands already. I'm going to put my gloves on. When you're using the gloves, make sure you have them fitting your hand correctly, no overlapping of the fingers. You can't have it like that. You need to have it nice and tight on the edge of your fingers. Now we're going to use the 21 gauge needle first. You have to be very careful when opening these so that you don't finger prick your finger there. Here we are, we just open it like this. My right hand is the dominant, so I'm going to pick the butterfly out with my left hand. Take the plastic sheath off, and before I remove it completely, I hold the needle in my left hand. Remove the plastic. Have my barrel. I put the barrel onto the needle, and then I screw with my dominant hand, not screw the left hand, and push on, and that's it attached. You can, if you like, stretch out the tube, but that's the length you have. So you can see the butterfly needle has a plastic sheath on it. Also, it's called a butterfly needle because it has wings. Now with these wings, they're pimply on one side and flat on the other side. You need to hold the butterfly that the pimples are on your fingers, and that way when you remove the plastic sheath, the bevel is the correct way. So what I'm going to do now is assess my patient, pop the tourniquet on. Okay, now I'm going to use this vein here on my patient. So release a little bit, get my alcohol wipe, and when you put the alcohol wipe on, you go from the inside out, don't go back into the center, and you just place the alcohol wipe there so I can palpate at a later date. Now with the mannequin, unfortunately he's not hot, so he doesn't dry. So what I'm going to do is just wipe the alcohol off. That way I won't slip. Okie doke. Now, this patient is going to be on a blood thinner, which is why I need my citrate tube, which is this blue one. It requires critical volume. So I'm going to use this plain tube, which is a purge tube first, then put the citrate on, then put the SST on. So what we're going to do is tighten tourniquet, hold my needle correctly, which is the pimple on my fingers, and remove the needle cover. Just pop it on there. I have my plain in the barrel, waiting. Alcohol on my finger. Palpate the vein, which I'm going to go in there, so I need to come down about this far. Anchor. Finger resting on the patient, and as you can see, the needle is just going to go straight in like that. So just tell my patient I'm just going to pop the needle in now, go in and along, and there we are. We're having blood going in. Patient's fine. I'm not releasing the butterfly, and I am not removing my fingers off the patient. To push the tube off, I just push. Just hang on to it in there. We're not using that one anyway. Here's my citrate tube. So to put the citrate tube on, you just do that. And it's my thumb that is pushing it on. And now it's the palm of my hand pushing it on. You can see it fills up quite quickly. Just releasing the tourniquet a little bit on my patient. There we are, it's full. I've pushed off. SST, same thing, it's a larger tube, but it's exactly the same. And there we are, the sample's going in. Push off. Pop the barrel in there. Now becomes the time of completely removing and releasing the tourniquet and removing the needle. Now with this one, I'm going to do this in a way that this is quite possibly a child, and the mother can't let go of the child to hold the cotton wool ball. So I'm going to put the cotton wool ball on and just take my fingers off. I am not releasing the butterfly wings at all. Gentle pressure, and when I say 3, I'm going to put pressure down on the finger and remove the butterfly. 1, 2, 3. There we are. Now, the patient would then hold that, and the correct way to close the butterfly, as you can see, my fingers have not moved. I need to put my thumb on this little dent, left finger underneath, left thumb, let go. Then I'm going to pull this tube, which is going to make the needle come down into this yellow casing here. The wings are actually going to come down. So we're going to go 1, 2, 3. I'm going to do it slowly so you can see. You can see with me pulling the tubing, the needle is going in. Now when we do this in front of a patient, we do it a lot quicker, and then we hang on to it, in and in, and that's how you remove the needle correctly. Okay, that was my first technique that I've shown you using the butterfly needle. That was with the 21 gauge. Now I'm going to show you the second technique, which I use with the 23 gauge. Following the same WHS and PPE rules and regulations, removing the butterfly exactly the same way, making sure I hold the needle in my less dominant hand. My barrel goes on very gently to not hurt the rubber that's on top of the needle. Screw in with my dominant hand and gently push. This is not connected onto this tightly, so we need to push it. We've stretched out the tube. The 23 gauge has exactly the same pimpling on the wing as the 21 gauge. Pimple goes between your fingers, where the soft bits go towards each other. Okay, we have our friend here again who's very kindly donated. I know I'm going to use this vein. I'm going to use the same vein that we used before. got my alcohol wipe, starting in the middle and working out. Do not go back into the center, and I'm just placing that there for when I can palpate my finger. Again, the mannequin doesn't dry, so I'm just going to do that, which is taking the alcohol off where I'm going to use. I'm going to use SST and EDTA. That is the correct order of draw. Okay, everything's ready. Tighten my tourniquet. That's the pimply bit on the wing there. Hold it in like that, which means when I remove the casing on the needle, the bevel is going to be the correct way, which I'll show you. I'll remove it now. Just a gentle twist and pull, and you can see the bevel of the needle is facing upwards, which is the way that we need it when it goes into the patient. Palpate my finger. Feel for the vein. I'm going to go in about there, so I'm going to come down. I'm going to rest my fingers on the patient and pop my needle in. There we are. Push on, and there we go. We're working perfectly. Loosening the tourniquet so it's not so tight on the patient. Remove, invert, pop the EDTA on, exactly the same as what we did before. Hold the tube down. You can see it's going in, always the label facing down. It's perfect. Push off with my finger, pop in here. Now this one, I'm going to ask the patient to help me. I just pop my barrel down here. I'm going to ask the patient to gently pop their finger on the cotton wool ball, and when I say 3, the patient is going to push down on the cotton wool ball. Now I need to put my left hand underneath the butterfly needle, put my thumb in the little dint that's there, and let the butterfly go. These fingers are now holding the butterfly needle exactly the same level as what it was before. Now I'm going to do this slowly. I now have the tube in my hand, and I'm just going to ask the patient, when I say 3, please push your finger down gently on there. So going slowly, 1, 2, 3, patient pushes down, and you can see that the needle is safe, locked in its safety. Okay, all good. So then what we do is pop the needle first into the sharps container, let the barrel go down. Patient will have held this for close to 5 minutes, usually by the time we write on the tubes. Make sure the patient is okay. Now with the band-aids, I peel the top of the band-aid off. Patients love this. I peel the edge over, and the patient is still holding, so then I take the bottom off. I ask the patient, can I have the cotton wool ball? Just in case when I go to lift it off and the vein starts bleeding again, I can push it back down. So we're going to take the cotton wool ball off. Absolutely perfect, you can't see any bleeding. I pop the band-aid on with the bit that I've peeled over on the top of the band-aid, and then what I normally do is give them a little smiley face, which always gets a giggle, and remove the tourniquet completely, and there we are. We've done 2 different types of correct butterfly technique for removal. Hope everything goes fine with your practicing. If you've got any questions, please give me a ring or an email, or even it'd be really good if you could answer, put a comment on my YouTube video. Thank you for attending. Good luck. Enjoy phlebotomy. It's a great career. Bye.